Treatment of personality disorders, Chapter 12. When we're looking at personality disorders, this is a quite sometimes tricky thing to do when we have our clients with us, because it's a fine line between figuring out if medication is necessary, because we are really treating those kind of personality symptoms. It isn't as clear cut from a kind of biological stance or a pharmacological stance as the other disorders, such as anxiety or or unipolar bipolar depression or psychosis or cognitive disorders, because we're more so dealing with personality disorders. So it's very important, is first and foremost, to obtain any kind of history, as much history as possible on the client. So we are looking at if there's any psychiatric previous psychiatric history, getting that medication history, family history is very important, and not just as to find out if anybody in the family has personality disorders, but to look at just the interpersonal interactions between the family and the family dynamics and different things like that, because it will give you a sense of the client, what they have gone through, and perhaps what is most important, because pharmacotherapy may not be an option, but of course it is a consideration. So with saying that, we also would like to look at, when we're gathering as much history and we're assessing, is there a comorbidity with the substance abuse? Because although we're treating the personality disorder, they might need additional assistance with substance abuse, whether it's the fact that if medication is decided to be used, we have to keep in mind that that the substance abuse is there, and that certain medications are not good because they are habit forming. Or we might look at, out of the two, what needs to be treated first. What is causing the most issues, the most problems, what really needs to be addressed, and it could be the substance abuse first before everything else. Not saying that you still couldn't see the client, but those are just things we have to take into consideration. And also, combination of various therapies are important. With personality disorders, various types of psychotherapy have been tried: dynamic, behavioral, cognitive, supportive, dialectical. But as a rule, the best way to approach these type of clients is to use a combination of various orientations, because sometimes they can be very complicated individuals. And as a rule of thumb, when treating personality disorders and looking at possible pharmacotherapy, keep in mind as a clinician that the focus is on targeting symptoms and their response to pharmacotherapy rather than just treating the diagnosis. So just always keep that in mind, that we're targeting those symptoms, especially with pharmacotherapy. There's no specific medications that have been found to be useful with people with personality disorders, as we can look and say, okay, antidepressants, SSRIs or SNRIs are good for this. Anticonvulsants can be used with bipolar disorder, with psychosis. But because of these personality disorders, and it isn't just as sometimes cut and dry as that, there's really no specific type of medication that we could say this is going to work. So the medications that are prescribed are based on symptoms. So when we look at the cluster A personality disorder, which is the paranoid, eccentric, thought disorder, dissociative disorder with kind of psychotic features, because we see these kind of things, they kind of display more of psychotic features. So we might look at, and that doesn't necessarily mean that, oh, cluster A, let's just give them antipsychotics. It's just the fact that we might take into consideration, out of all of these or all the various types of drugs, maybe we might try a low dose of antipsychotics based on this client's symptoms. Cluster B, the impulsive, depressive, angry, labile kind of person, because it's an affective disorder, we might look at something like an antidepressant, like an SSRI, or perhaps atypical antipsychotic. So this one, of course, based on symptomology, this is going to play a part in perhaps what might be beneficial. And even though these are just thoughts, notes to self we might have, they really might not be beneficial. But if we were to uh, kind of categorize certain medications that might be beneficial to a person with personality disorders, this is just what it's presenting in the book, and possible, just based on research that have been effective. With our cluster C, the anxious avoidant, we're looking at SSRIs and benzodiazepines. Because we have that anxiousness, kind of we take into consideration maybe like the anxiety part. Then SSRIs have played a part with, anxiety, as well as, just that whole avoidant part. Once again, keeping in mind when we talk about the hypnotic, certain settings and certain medications, that they can have an addictive quality. So if you know your client has a history of substance abuse, you might want to avoid benzodiazepines, and that's just something that we always want to keep in the back of our mind.